Allergy tests are really most useful when they're carried out in conjunction with the history. So if there isn't a strong history and the physical examination and the family history doesn't suggest that an allergy exists, the testing is much less valuable. Its interpretation is key when it's used in conjunction with everything else. So the GP might assess everything and say, in this case, it's not appropriate. Equally, the GP may just not have enough specialist knowledge and be a little bit dismissive. And if you think that's the case, then look at the guidelines published by the National Institute for Health and Care Excellence and maybe discuss those with the GP or find a GP who is more sympathetic. Another alternative is to go privately to a recognised specialist. I wish that wasn't the case, that people didn't have to do that, but unfortunately the reality is that there are very few allergy specialists and people find that the wait is quite long, weeks or months. And if you already have a child or the child that you're worried about has already had an anaphylactic reaction and is using an adrenaline pen or has had acute asthma, then you might want to do things more urgently. What I would encourage people not to do is to go to the various high street outlets or people that you can find online who claim to use complementary diagnostic tests which haven't been scientifically validated or recognised and could cause more harm than good. So I think stay with a reputable, proven, orthodox source of help, but make sure you are assertive and you push for the right kind of help.